Welcome to ME 108. This week's lecture is talking about anesthesia codes. When coding for specific procedures, you have all these procedures that mean specific things. Then you have a code for other procedures. This is 01990 to 01999. The last few CPT anesthesia codes are miscellaneous codes reporting anesthesia services that are not otherwise classified, including 01990, which is physiological support for harvesting an organ from brain dead patient, 01991, anesthesia for diagnostic and therapeutic nerve blocks and injections other than prone position. 01992, anesthesia for diagnostic or therapeutic nerve blocks and injection in the prone position. And you also have 01996, which is daily hospital management of epidural and subarachnoid continuous drug administration. Coding for anesthesia services is different than coding for any other professional service. The choice of the code does not depend on what the anesthesia provider did for the patient. The total time the anesthesia services are provided is reported as separately identifiable services. A single anesthesia code can describe anesthetics for a large number of surgical procedures. And each anesthesia code is assigned a base unit value that's used by payers to calculate payment for anesthesia services, such as 10-minute increments, 15, such as that. Time is a factor that must be reported with each anesthesia code. Time is calculated in different ways depending on the payer. The two most common methods for either one time unit for each 15 minutes, are either one time unit for each 15 minutes of anesthetic or anesthesia time, or the number of minutes. And these are rounded up. Secondary aspects of anesthesia services are reported with modifiers and add-on codes. Now, the modifiers are added to anesthesia procedure codes to provide information regarding the physical status of the patient, information regarding who delivered the anesthetic, and the justification for MAC anesthesia. Add-on codes are used to report certain qualifying circumstances, including extremes of age, use of hypotension and hypothermia techniques, and whether the case is an emergency procedure. Excuse me. Those modifiers and add-on codes may affect the payment for those services, but this can vary from payer to payer. Payment for anesthesia services is based on the total number of anesthesia units that a particular case is valued at based on a set formula. And that basic formula is basic units plus time units plus physical status modifier units plus qualifying circumstances add-on code units equals total anesthesia units. And not all payers recognize units for physical status modifiers or qualifying circumstances, so you really need to understand that. Most anesthesia codes are classified according to the anatomical location of the underlying procedure, and some services are classified by the type of procedure that makes the anesthesia necessary. Having said all that, I mean, there is so much. For instance, there say your upper leg. Well, your upper leg, except knee, is 01200 to 01274. And these codes describe anesthesia for surgical procedures on the hip joint and upper two-thirds of the femur. Examples of the codes include 01210, which is anesthesia for open procedures involving hip joint, not otherwise specified. And then you have 01214, which is anesthesia for open procedures involving the hip joint, total hip arthroplasty. Pelvis, except hip, 0112 to 01190. These codes describe anesthesia for procedures on the bony pelvis and surrounding structures when a part of the procedure is performed on the pelvic bones. Examples can be 01112, anesthesia for bone marrow aspiration and or biopsy, anterior or posterior iliac crest. 01120 is anesthesia for procedures on the bony pelvis. It is so interesting how we have to code for all of these anesthesia codes, and how we have different meanings, and each part has to be broken down. So I hope you read the material and make sure to do your work and enjoy studying just as much as I enjoy teaching. Thank you. Have a good day.